My name is Patient Bea. I'm a Canadian, original from Democratic Republic of Congo, and then currently I'm based in Rwanda, try to bring my skill to the need of people in Rwanda and across Africa. I'm a registered dietitian in Canada. I run a non-profit organization registered in Canada, and then I wanted to really bring that expertise, especially for what we said, non-communicable disease such as diabetes, obesity. It become very present on the continent in Africa. So for me, that's one of the reasons I really want to bring that expertise to save lives, but also another way to show there is a business within the healthcare sector, which is the most not well explored as a way of protecting people's health. So that's why for me being in Rwanda here is another way to bring that expertise so I can contribute into promoting good health for people, protecting them as well. And at the end of the day, how we sustain our own business in healthcare sectors by providing services, and that income come back and we'll reinvest it back as a way to help people who cannot afford and access these services. I always wanted to be a medical doctor, and then when I was reaching high school, because in Congo you have to do already a specialization in high school, so my dad was like, why don't you look into nutrition and dietetics? So for me, I was not quite sure if it was something I wanted, but he told me that when you look at nutrition and dietetics, is part of the medicine and is less used as to way to promote good health and protect people's health. So I kind of not believe him, and he was saying like, you know what, you have to look things in the 10 years coming, because things will shift. Medicine, general medicine may not have great impact as a nutrition. So I give it a chance, and that's how I actually end up being in nutrition. I started high school in nutrition and dietetics, and then unfortunately when I was finishing high school, my dad passed away, and I was quite discouraged to kind of pursue that. But eventually I found a way to say that, you know what, I'm gonna try to honor his guidance, and I decided to pursue with it in university. And in university, I continued with dietetics and nutrition. Finally, I get graduated, and when I was graduated, you know, job for young people in Africa is quite tough and challenging. I was fortunate to get a job with international NGO, and that's how actually I started seeing the value of that advice from my dad to be a dietitian. And then eventually that advice have allowed me to travel the world, across Africa, across Europe, across America, and eventually I was also blessed to recognize that that opportunity he have put in my hand, it have allowed me now to pursue again in Canada. And I continue another 2 years in Canada, specializing in dietetics with a broad perspective in terms of non-communicable diseases like diabetes, obesity. So I would say that it has been one of the best decisions I ever made in my life to listen to my dad, to that advice. Unfortunately, he's not here today for me to say thank to him for allowing me to see the other side of medicine from dietetics perspective. The long-term and short-term goals all they're back to the vision that I have. And the vision for our organization or business is create community where people eat healthy, live well, and fulfill their potential. And then the short-term goal for me is to see how actually my organization can create a platform to recruit, train competent health workers. Because that is the number one problem across accessing safe and high quality care across Africa. So for me, my short-term goals is to how I'm gonna recruit, train people that can become a source of providing that safe healthcare. And the long-term goals is creating a space where people actually access evidence-based care that is more focused on prevention of non-communicable disease, because it costs less money to people and creates social security for them compared to treatment. And then the second long-term goal is actually how I can embed, how I can integrate data to inform healthcare system reform across Africa. Why am I saying that? Because when you look at, we have a problem with valid data available. So because there's no way to capture those data. So for me, our long term is start capturing data so we can build our own database that is a purely reflection of the African context of healthcare issues and opportunities and how to fix it. Those are our long-term goals that we really want to, number one, create access to safe and high-quality care based on evidence base that is delivered by competent and trained healthcare workers. And number two, create a database to capture data to inform reform in healthcare system based on the context of each African countries. One of the business aspirations I have part of this as well is to continue in the area of nutrition, human nutrition and food science. One of them is about looking about addressing food insecurity for people living with non-communicable disease at the community level, but also in hospital setting. Where I came from in Canada, patients most of the time access that meal therapy through the hospital. So patients eat from the hospital, but the food that they're receiving from the hospital, they're not the same as the food we cook at home, because that is completely therapeutic. It's based on the condition that patients have been admitted. So one of the aspiration business I'm trying to address also is to fill the gap within the food system and healthcare system for patients that has been hospitalized. So try to find a way actually how we can use the food services and management to fill the gap so patients when they're hospitalized, they're eating therapeutic food that is based on evidence, to reduce the length of stay in hospital, to reduce the complication. So that's another aspiration I'm looking into, but again to create an experience, because it does not mean when you're hospitalized you should give up your cultural food preferences. And that's where for us, my aspiration is about how actually we can continue to give you that experience, accessing your cultural food preferences despite being in a hospital, but at the same time promoting your healing and reducing your length of stay in hospital. So that is another aspiration that I'm trying to look into from the business, because there is a big gap from that perspective. We have to think about cost-effective intervention, because when myself, coming from Africa, growing up in Africa, work in Canada, we have what we call social determinant of health. Among of them is like income, working condition, gender, healthcare system. Those are the things influence individual health. So prevention actually is addressing those underlying factors. Typically, I can prevent like a diabetes with less than 40 cents. But if I get diabetes, an average cost to treat it roughly is between $25 to $300. But if you look at average income for people in Africa, for some class, below $300 a month. So how do you expect them to protect their health and continue providing social security for their family? So that's why for me, I really believe into more prevention. It costs less money, but at the same time, we protect people's lives. Number one, I would say that is about know the problem you're trying to address. And I have one of our professors that always say that fall in love with the problem, not with the solution. So you have to understand what is the problem, the wicked problem you're trying to solve from business perspective, how that will attract investors. Are you talking to your client? That skill of situational analysis, understanding your business and your customers, the challenge and opportunities, that is skill number one, like understanding that. Number two is about operation management. When I talk about operation because operation deliver your strategy of your business. Because you cannot achieve your strategy if you don't have a good operation in place. So for me, be able to sustain the business for 4 years, I've completely understand the operation in terms of like sub-function of my operation, from human resources, from finance, from a strategy point of developing business, product, services, from policy and regulation, because those are the things actually can shake your business. So having skill from those areas definitely is number one. Number two, be patient, because being an entrepreneur in a business, there is a lot of uncertainty and volatile things that happen. So you have to be able to adapt yourself. So that I would say that, I always say that there is this theory in a leadership called VUCA world. So VUCA stands for volatile, uncertainty, complex, and adaptation. To survive in this business, you have to be able to adapt yourself from that VUCA world by having that skill. COVID have shown us you can adapt based on the environment. So that's what I would say. Two skill, understand the business from many perspectives, by having operational skills, how you do your situational analysis to understand your customers, the policy and regulation, how that can shape your business strategy, and also the last one, your skill of being patient and understanding the world that you're operating and how you adapt. For me, typically, I always believe that, you know, I have those skills. It allows me to drive the technical part, but there is the people also make decisions. So I have to work on my interpersonal skill, communication, so I can sell the vision I have to people that I know within the network that can help me. So I would say the skill I've really worked hard is about how I build good relationship that is trusted, I maintain them, and I leverage on it. That personal relationship and interaction, that has been like my way, my strength, skill that I've been working on it, and I'm continuing to work, because from one country to another country, culture are different. So I have to adapt. And that way I will say that I'm continuing to learn how to leverage that relationship, building maintenance from different cultural perspective. With all the challenges I've been facing, try to run business across Africa, I will give credit to the institution that I'm going currently. I'm doing my MBA and leadership at African Leadership University. So through this journey, I've really learned how an entrepreneurship is all about effective leadership. But that effective leadership is driven by three things: the vision you have, the value you are trying to create into tuning into the market, and the virtue. When we talk about virtue, are you making ethical decisions? Are you developing others? Are you having empathy? Are you resilient? So to answer your question, that was the moment that I had a low moment. I was like, I gotta give up. So I'm not the one who's gonna fix those issues in Africa related to non-communicable disease. But through this journey with my university, I learned resilience is what a leader needs. I have developed to be resilient. But when I relate my resilience to the vision that I have for the continent, that has been a source of giving me back the energy, pick up myself up, and keep moving. Wow. What I love about entrepreneurship, it pushes you out of your comfort zone. And being pushed out of your comfort zone, you constantly find yourself in a learning zone. And I found myself, actually, there's a lot of potential that I never unlocked when I was in a 9-to-5 job. So that beauty of entrepreneurship, of pushing yourself out of your comfort zone. Because I found the more I'm out of my comfort zone, there is a window of opportunity for learning and growth. And I've seen myself. So that's what I love about entrepreneurship, right? And then another thing that I would say, I'll give a simple example, is like with entrepreneurship, you're in constant interaction with the world that's changing. And you have to keep learning how to discern a new threat. I'll give you an example. There is this theory of adapting in a changing, evolving world. For example, if you have a chimpanzee in front of a tiger, their only defense of protecting themselves, they have to come as a pack. So that's the only solution to discern the new threat. But if you remove the tiger on the picture, you put a human with a machine gun. If they're going with the same approach of protection as they did in the front of a tiger, it's clear they're going to be completely eliminated. So you have to rethink which way of protecting themselves from the new threat. So that's why I would say that another thing I love about entrepreneurship is constant way of adapting, how to discern the new threat that's keep raising on your way of building product, services to serve the community. There is a policies and regulation that give you a way to know where to start. And number two, I would say that there is an interest in what I'm trying to do, especially non-communicable diseases become a top agenda for the government because they realize that these NCD issues is a major issues, not for Rwanda, but for the whole Africa, right? And then also I would say that another positive side of it, you see there is a part of accountability and transparency from policy making, so to show that what you need, we can actually, this is the ABCD to get what you want. So that clear path of knowing what you need to do, I would say that is one of the positive aspects of it. Despite, of course, there is not perfect system. Part of the system is to continue to receive feedback, improving and have experience, despite some challenges may also raise. But again, it's about how you try to tap into those challenges and provide feedback so the system can continue to improve, because it's not one size fits all. The connection from policy making and implementation, those are the challenges I've faced across Africa. It's not going to be particular only to Rwanda, but because you have a vision hub there, those people make, the stakeholders and decision makers, they have a clear vision, the elites understand the vision, but now it's about from the implementation aspect, because some aspect of those policy and regulations in real life, in the practical aspect of things, there is a disconnection, right? I'll give a simple example. I've been trying to run the business, showing that this is what I'm trying to do. Of course, it's new, but the people at the implementation level do not understand. And there is a checklist. So when you are presenting a project that is not matching with the checklist, then you're stuck. So then the only way to unlock it, you have to go back to the higher level of policy makers to show that this is a new thing I'm trying to propose, but at the implementation level, there is a checklist that my project, my business is not fitting within. So that's what I said, it has been one of the challenges. So then you have to find a way to meet with people who sit at the high level of policy. They have a clear vision of how they are seeing things supposed to move. And then some of them, they are responsive to help to unlock that blockage at that implementation level. So I said, overall, the challenge is about how you reconcile the policy making and the implementation level. The African diaspora, they are part of the solution for Africa problem. So we had an opportunity to learn. We have an opportunity to bring that learning to address the Africa problems, adapting those solutions and skill to our own context in Africa. If we don't come back as the diaspora to address the African problems, there is no one who will come to help us. So I would say that I will encourage every diaspora who is listening to me, do not let the fear of challenges and the connotation that constantly Africa have been put is corrupted, there is a lot of policy, politics. We have to live with it. We have to start shaping our own story by bringing our skill to develop our own continent, because we all have something to offer. So I would say that find the right people within government, within countries. You can tell your story, how you want to contribute to the development of this continent. And the reality is that we are 1.3 billion young population globally. So meaning that we are the one actually is going to write the history of the world for the next centuries coming. So let's work together, bring what we have learned, adapt them to our context, and let's transform the Africa. So that's what I'll tell them, because we have doctors, we have dieticians, we have nurses, we have lawyers. So we have a politician that actually they are in diaspora working for government. What have you learned? How can you bring them back to our continent? We start that small change. So that's what I would say, that we have a room for everyone, but do not let the fear of Africa is a problem. We have solution, but let's fall in love with our own African problem, and then we can come up with the best solution together. Wherever you have a chance, share the best stories of Africa. Become an advocate for telling that as an African, we need a meaningful partnership with the West. Because today it's clear that Africa is the future of the world. And I would say, without good health, we cannot build the Africa we want. Without good leadership, we cannot build strong and reliable institutions. So we have to start investing in the building good quality of leaders so we can create good governance. That good governance will create a better healthcare system to protect our youth workforce who will be part of transforming Africa. And I will leave by saying that the health of today is the investment from yesterday. Tips or advice will be, try to understand the ecosystem that you are trying to do entrepreneurship and innovation. And among the big challenge that entrepreneurs face a lot is policies and regulations. And some of those regulations and policies in Africa, they are completely obsolete because they are coming from colonial, is a copy and paste. So you as an entrepreneurship, try to understand where is the gap within the existing policies and how actually I can tap into it to bring solutions that actually is fitting the context of the country, of the continent. Another one will be the business model. Africa does not need charity anymore. We have resources, but it's how you decide to leverage on those existing resources. By that mean that people are willing to pay for services when they see the value of it. And part of what I'm trying to do, I'm trying to stay completely depending on donors, but creating a new model of business where actually it's community contributing to financing this solution to their own problem. That's how we create sustainable development addressing our problem. So that's what I said. Think about the model of business that probably 80% rely on the source of revenue from your business model rather than fundings. Because when the funders decide to stop, your business also die. As an entrepreneur, look for feedback. Because feedback is the drive forces for you to have a break, to stop, to think, what am I doing right? What am I doing wrong? How can I change it? Find a neutral person you don't know, say, hey, here's my project, here's my idea. What do you think? Feedback is the fuel. Exploit it.